A 58-year-old male with history of COPD and lung cancer presents with constant generalized weakness and fatigue that has been consistently worsening over the last 4 days. He notes that his activities of daily living have been severely affected and is non-ambulatory starting today. He is an auto shop worker, and he notes that at the end of the workday, the symptoms seem to be worse and nothing makes them better. Along with the weakness and fatigue, he's experiencing joint stiffness, muscle stiffness, oliguria, anorexia, unintentional weight loss, and lightheadedness. He states that he's been trying to drink water, but his mouth always feels dry and he seems to be craving salt. He states that he has xeroderma and dark spots on his hand that have been there for the last month, and he denies pruritus or discolorization to the eyes. He also denies fever, chills, nausea, or vomiting, and he states that he feels like his heart is always racing and that he seems to be increasingly short of breath. He denies confusion, but he notes that he has been feeling depressed, and he denies any increased bleeding, bruising, numbness, or changes to the nails or erectile dysfunction. On physical exam, he appears to be cachectic. He has hypotension that is not orthostatic and tachycardia. He also has 1+ pedal edema. The buccal mucosa and lips are dry in appearance. The lungs have noted fremitus throughout and rail symmetrically, and expansion is equal and symmetric. The musculoskeletal exam showed some atrophy, but there was no joint swelling, and he had normal range of motion. The abdomen was scaphoid in appearance with decreased bowel sounds and an absence of ascites. The skin exam showed hyperpigmentation of both hands and was dry, but all other systems were unremarkable. The lab results showed decreased cortisol, albumin, glucose, and sodium, and increased ACTH, creatinine, BUN, and potassium. The CBC showed increased white blood cell count with decreased hemoglobin, platelets, and band forms. On CT of the abdomen and pelvis with contrast, there was indicated metastasis through both adrenal glands and new metastasis within both lungs in comparison to a scan 3 years ago, but no evidence of metastasis to the liver. And CT of the lungs with contrast showed diffuse metastasis bilaterally. Based on these findings, especially low cortisol levels and metastasis to the adrenal glands, I believe that the patient has adrenal insufficiency. Since the adrenal glands themselves are being affected directly and the patient has hyperpigmentation, I believe that this is primary adrenal insufficiency. The patient does not have a PCP to follow up with, so I'd like to indicate some within the area, as well as give him some recommendations to oncology for further follow-up and further management. I am worried about the patient having adrenal crisis, but the patient did not present with orthostasis, abdominal cramping, nausea, and his CT results, although they did show infiltrates to the lungs bilaterally into both adrenal glands, they did not note any hemorrhage. The patient is at an increased risk of infection, and he has low hemoglobin and low platelets, so I am concerned that if this goes any further that he could be in crisis, but as of right now, I don't think that he is.